Hello, I'm Professor Joe Thomas.
Dr. Joe Thomas is an accomplished institution builder, academic, diplomat, and a global leader in public health rights and social development for over 25 years. Currently, Dr. Thomas is working as the Professor of Public Health and the National Course Convener at the Institute of Health and Management in Rosanna, Victoria, Australia.
Today, I would like to briefly introduce some of the determinants of health and well-being. Today, a child born in Australia is likely to live up to 83 years, whereas the child born in UK may live up to 81 years old. United States, it could be 79 years old. Switzerland, it could be 80 years old. Whereas a child born in India is likely to live up to 66 years old. Whereas Japan, it could go up to 85 years. And again, when you look at Zimbabwe, a child born today may live only up to the age of 51. But again, when we look at the data a little more carefully, if that child in Australia is born in an indigenous family, that child is likely to live only up to 71 years old. That means there's almost more than 10 to 12 years of age gap between, life expectancy gap between an indigenous Australian child and a mainstream Anglo-Saxon child. This is the same case in India. If you compare with the national average of 63, and the life expectancy in a state like Kerala, it is 75 years old. Whereas in Assam, it is 56. And what it shows is that there's a huge variation between how long a person is likely to live. And these are some of the collective factors. We broadly call it as the determinants of health. And there are different sets of determinants of health. And broadly, we classify it as a set of determinants which falls under the social determinants, certain set of variables which falls under the structural determinants of health. Third sets, we can call it as the commercial determinants of health. And the fourth set of variables are environmental determinants. And why I'm trying to explain this is that normally when we talk about health and well-being, what comes into our mind is hospitals, specialization, equipments, and also the larger hospitals. So these are some of the images coming into our mind. But in a closer examination, from a public health perspective, we used to say that health is normally outside the hospital, or the variables which are impacting, influencing health are quite often beyond the influence of Ministry of Health. And at the same time, they may not have influence on that variables either. This is just to bring home this main point. I very simplistically presented it. And when you look at what are the social determinants of health, they are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. And also when you look at structural determinants, there are economic policies related with the health. There are national development agenda. What kind of development is a nation is aspiring? And what are the social norms? What social policies, what health policies, and what is the political system we have to implement those policies? These are some of the structural determinants of health. And also we know that the gender equality or gender inequity is a major contributing factor. And again, when we look at very closely, the racial discrimination or the caste-based discrimination contributed towards health and well-being, just to give another set of variables. And when you look at specifically what are the social determinants of health, they are income and the existence or non-existence of social protection mechanisms. Level of education quite often contribute towards health and well-being. And the level of unemployment or job insecurity can hugely impact on health and health outcome, particularly on the mental health. Food insecurity. Access to food is, that's the most essential component of survival and existence. And food security contributed towards health inequity. And also the basic housing, basic amenities, and the immediate environment also contribute towards health and well-being. And we know today, your early childhood experience, the early childhood development experience contributing towards the health and well-being of your later years or your older years of the life. And again, what I mentioned earlier, the social inclusion and social discrimination. For example, in many societies, there are unwritten code of conduct rules about who could access healthcare, who could access which doctor. Caste discrimination, racial discrimination plays an important role in the level of access to healthcare. And also, an important factor is our access to affordable health services of decent quality. In some countries, we know that they have to pay from your pocket for the healthcare. In some societies, there are universal access to healthcare without paying. This is as a part of your a citizenship right of the country. So that varies. That determines hugely about the quality of life and well-being. For example, if you look at the life expectancy of Australia and compare that with the United States, probably the difference between the life expectancy of United States and Australia may be because of the quality of access to healthcare. Because we know that Australia is largely what we call it as a free healthcare. Access to healthcare is a universal and it is a citizen's right, whereas United States, you pay from your out of pocket. And today we have much more greater understanding about some of the commercial determinants of health. And they are the private sector activities that affect people's health positively or negatively. Today we know that the private sector, private industries can influence social, physical, and cultural environment through their business action, through their business promotion, through their societal engagement, supply chain, labor condition, product design, packaging, research funding, lobbying, so all contribute towards health and well-being. For example, we look at the food processing. Most of the food is processed. We don't eat non-processed food. But the problem is that there are different levels of processing. And the highest level processing, the complex processing, it quite often, there are more than 4 or 5 variables or ingredients are added to the original stuff, and it becoming a chemical concoction, and it's still sold as a food. So this is just an example about commercial determinants are impacting on the health and well-being. The critical example is too from, if you know that the tobacco industry, how it is impacting on the health. Alcohol industry is another example about how the commercial interests are impacting on the health and well-being. And when you look at the environmental factors which contributing towards health and well-being, today we know that the indoor pollution, outdoor pollution, drinking water contamination, occupational exposure to hazardous material, for example, exposure to asbestos roofing in many of the schools and hospitals can contribute towards these carcinogenic materials. And also lead exposure in the paint can have a serious health impact on the children. And sometimes the built environment discourage physical activity. Today we know that gestational diabetics, the diabetics at the later stage of pregnancy, is also linked with lack of physical exercise. And quite often women, the pregnant mothers, they may not have a safe and secure working place, because we know that the public space is mostly men's space. There is a gender implication on access to public space. So many women may not be able to or afford to walk in public space safely. So I just give a broader introduction to some of the variables, some of the set of variables which is contributing health and well-being. And today we know that access to medical care is only one component or one variable, though it's a significant variable, which are contributing collectively to the health and well-being. Today, the public health look at what are those variables which are contributing towards health and well-being. And public health gives a structured framework to understand, to analyze, and also to come out with a prevention intervention to deal with or improving health and well-being on a societal level. Thank you very much.